It's dawn in Kampala. The mist over Lake Victoria drifts slowly into Uganda's capital city and blends into the smoke of cookpots and coal fires in the city slums. In the quiet seclusion of Makerere University, students participating in Chicago Lakeshore Medical Associates' Global Health Initiative are preparing for another day in the wards of Mulago Hospital. The hospital is the largest government-run health facility in the country, serving as both a teaching center and last resort for Uganda's 24 million, mostly poor, residents. Their daily walk to work takes them through the bustle of traffic that makes Kampala go. Past garbage-strewn lots where water buffalo graze unattended. And families camped outside the hospital doors, waiting to hear the fate of their loved ones. The students are on a 4-week sabbatical that sends soon-to-be doctors around the globe for real-life training, treating some of the world's most intractable health problems. Over the last 4 years, Northwestern students have taken their skills to clinics in 23 countries, including Bolivia, Belize, Nicaragua, and Nigeria, under grants sponsored by the Global Health Initiative. This year, there is a new twist to the program, as fourth-year students at Northwestern work side by side with Ugandan medical colleagues, exploring their different approaches to medicine.
First few days, obviously, here in Uganda, were a bit of a culture shock. We saw things that we would never see back home at Northwestern. And learning to deal with that and learning to just observe the medical students, the medical staff was for me very, very, very useful.
Becky DeBoer is a fourth-year medical student at Northwestern who is considering a master's degree in medical humanities and bioethics. She feels she learns as much from her colleagues as she gives.
Actually, I've had several of the Ugandan medical students I've been working with have sort of taught me a lot about their physical exam techniques. And I'm starting to feel more competent in terms of just assessing patients based on a history and physical without all of the labs and imaging studies that we're used to having in the computer at, in the United States.
And in the red blood cell, again, these parasites start feeding on the hemoglobin.
When they are not seeing patients, students get special instruction in tropical diseases and the public health measures officials are taking. Uganda leads the African continent in the reduction of HIV, from 30% to 6% of residents in 2008. And doctors have now turned their attention to combating malaria.
I think it's really important to realize that what we've seen at Northwestern Memorial Hospital is just a tiny sliver of what the reality of disease is globally.
How are you?
Being here makes me want to come back as a resident, and when I am feeling more competent with prescribing medications and ordering tests, because there's the need here is so great. I think that we all have sort of felt this urge to try to be more useful.
The students' experience in Uganda includes a visit to an AIDS clinic serving Ugandan women, and a trip to an outlying village where public health resources are at their most remote.
Whenever we come to the village or to the community for a meeting or a sensitization, we emphasize boiling of water. But some end up not doing it.
And a tour of one of Kampala's worst slums.
It was definitely an eye-opening experience. Several of the people in the slums let us come into their houses and see where they slept and see where they cooked their food. Seeing them doing that, I think, really makes an impression and makes you realize, wow, every morning you have to get up and build a fire and cook your grains. And seeing the little kids and the conditions that they have to live in. They're just people, and the environment they live in is pretty awful. So, yeah, it definitely made an impression.
Practicing medicine in a third world country is always full of challenges.
The biggest problem is plainly resources, whether it's drugs or blood pressure cuffs. I've had, patients who are acutely sick, like very, very ill, and where vitals are so important, yet I have to run around for 10 minutes just looking for a blood pressure cuff so I can take this patient's vitals.
Improvising in a difficult situation makes for better doctors at home and abroad.
I think programs like the Global Health Initiative help to set the stage for people that are at this point in our lives where we're still trying to figure out what role global health will play in our careers.
So I think it's important to come to somewhere like here where you see what actually happens and you feel the frustration and the hopelessness and all of those things that you didn't expect. Even today we were taking care of patients that we didn't necessarily know what was going on, but we had to figure it out. And I think that's something that's very important to know, that you will figure it out and things will be okay as long as you use your resources properly and use your knowledge properly. And so I think it's a very inspiring experience.
The task is daunting, but the desire to make a difference in the world is strong in these young doctors. And your support of the Global Health Initiative helps take them to the places where that compassionate spirit is most needed.